Shirley Tabb, your community social worker and case manager. And over the past few years, I have helped a lot of people. Some of you watching today, I have helped get home health services through the DC EPD Medicaid waiver program. And over the years, many people have called me, my clients and people from the community, about various components of the community home health industry. There are sometimes problems and concerns. That's why today I am really so excited and pleased to bring to you the first of what I hope to be a series of these talk shows under my show, The Case Manager, because I am the case manager. And I will be answering various questions, some of which we have already gathered, and I will be answering these questions to help people to get the most from their home health care experience. It's a wonderful program. My mother was in this program, and it was such a blessing to me when I had to work, but yet I knew that my mother was safe and well taken care of at home while I was working. We are going to go to our list of questions right now. As a matter of fact, we have a call from Bonita in Northwest Washington, D.C., and Bonita wants to know, what is the EPD waiver program, and is it available in other states, since she does have relatives who live outside of the District of Columbia? And that's a good question, Bonita. We thank you for that question. Yes, the EPD Medicaid waiver program is a national program, and the EPD stands for the Elderly and Persons with Physical Disabilities Medicaid waiver program, and it's a program for people who are elderly, yet they may not be elderly, but they may have chronic illnesses such as HIV/AIDS or diabetes, and still need care with personal care assistance in order to remain in their homes and communities, as opposed to going to nursing homes. And yes, it is a national program, and if you live in another jurisdiction, you would call your local Medicaid office and ask them about the eligibility requirements and the process for getting Medicaid waiver services wherever you are nationally. And Rachel from Southeast Washington wants to know how she can get services for herself or a loved one. Well, what you do in order to get a Medicaid waiver home health services would be first to contact a home health agency or a case manager like me. We will be putting my number up on the screen shortly, and feel free to give me a call. What I do as the case manager is to make a home visit initially and do an assessment of the particular home situation to see exactly where the needs are. Are there needs with assistance bathing, cooking? Do you need someone to go to the grocery store for you? When my mother was in the program, it worked so great for me because we had a home health aide, and when it was time to take Mama to the doctor, I would drive right up to the front door, and the aide would take Mama out, and they would go on in, and she would help Mama to get checked in, and I had the luxury of taking my time to find just the right parking space. And of course, the aides do other things with personal care. They help people get their baths. A lot of senior citizens are afraid to get in a bathtub because they're afraid they can't get out. And that's a legitimate concern with the mobility issues that some of our seniors and people with physical disabilities have. So I would come out to your home to make this assessment. And then once I make my assessment as a trained clinical social worker and case manager, then the doctor, your primary care physician, would need to sign off on what we call a level of care form, and the doctor would need to agree with my assessment that you do need care in your home in order to remain in your home as opposed to going to a nursing home. So that's the beginning process there. Give me a call and I'll be glad to give you more information about that. We have another call that that we collected also from Lamont, and Lamont lives in Northeast, and Lamont wants to know, is asking a question that so many people do ask me, and that is, how do I know, Shirley, that it's safe to bring strange people into my home? And that's an excellent question. Well, the home health aides who would be assigned to work for you, they have been cleared through police clearances, and the home health agencies are bonded and well insured. So it is a safe process. Now, that being said, I always tell my clients to don't go and do something stupid. I mean, if you have $100 cash in your purse, then you wouldn't want to leave that purse lying around regardless of who was there in your home. You would want to put up your valuables because you could lose something and then end up blaming it on somebody innocently. So as a participant in the home health program, our clients also have the duty to act responsibly as well. But for the most part, most aides are very honest and they are hardworking people. Of course, when you run into situations where that's not the case, we'll be talking later today about what you would do in that instance as well. The format for my shows will be, again, to help people to get the most from their home health experience. And that is, hopefully, that's going to come from further dialogue and bringing you information. And we're going to even talk about resources. DC has some wonderful resources, but a lot of people don't know about these resources. And we will be talking about these resources so we can help fortify your efforts and your family's efforts to remain in your homes comfortably and safely. Another component, the Medicaid waiver home health program has several components. One component is, in addition to personal care assistance, where someone comes to your home from 2 to 3 hours, 4 hours a day, all the way up to 16 hours a day, 7 days, if medically necessary, if the doctor and the social worker feels that it's necessary, particularly if someone is bed-bound and is unable to do anything for themselves, then naturally they qualify for more hours than someone who just needs some help with personal care assistance or keeping their homes tidy and these kind of things. So you have the personal care assistant, but you also get, with the Medicaid waiver home health program, a person like me, a case manager. And my job as a case manager is to help you to facilitate access to community resources. You might need glasses and don't know where to go get these glasses because you don't have traditional insurance, as so many of us do not. So, but the case manager's role is to help you access these services, to identify services that you qualify for. Another wonderful component of the Medicaid waiver program is the enhancement of personal safety through the use of the personal emergency response system. And various companies call this personal emergency response system various things. Some people call it Link to Life. Some people call it Life Alert. But what it is, it's a system that's monitored 24 hours a day, 7 days a week. So should you fall in your home and you are there alone, and you've seen years ago, they had the commercial where the little lady fell and said, I've fallen and I can't get up. All of us my age remember that commercial because it was quite telling. So the government is happy to have this personal emergency response system installed so that people don't remain on the floor for hours, or even in some unfortunate cases, people have remained on the floor for days because nobody came by. They couldn't call anybody. They couldn't get to their phone, and nobody could hear them calling out for help. So they will put in the personal emergency response system, and a nurse will come by once a month or more if the doctor orders it, if it's medically necessary. But it's standard practice that the nurse comes just to ensure that our clients are doing okay. And the nurse's job is also to collaborate with your medical team to let them know if she or he becomes aware of something that might be troublesome or alarming, and they will let your doctor know. So those are the main components of the Medicaid waiver program. Now there's another component, and we will talk about this component in resources. But inside each Medicaid waiver beneficiary's package of services also comes assistance with what we call assistive devices. Say, for instance, you need a stair lift. And so many of our seniors and people with disabilities live in older homes, and they must encounter stairs. Many of my clients have had to move from their bedrooms upstairs down to the first floor of their homes, and now living rooms and dining rooms are being converted to living quarters, which is fine. But there are funds available to put in wheelchair ramps and stair lifts. And there's a third component of the home modifications. We can also assist you with widening the doors of your bathroom, for example, if it's not wide enough to accommodate your wheelchair or your walker. And call me. I'll be glad to tell you all about how you go and start this application. However, I must be honest with you, it's a long, very bureaucratic process, and we hope to see that change now soon, but it's a long process. That being said, if you follow the process, then that's an approved service inside the Medicaid waiver program.